I'm Joe Kennedy. I'm an assistant professor of emergency medicine at the Larner College of Medicine and an emergency physician at the University of Vermont Medical Center. To walk through the doors of the emergency department is to get ready for a period of unpredictability. It's probably a tough day in your life, and for most of the staff, we're working in tough conditions, but we're generally very excited to take care of you. And we want to provide the best care we can, but we don't always have the means or resources or even the heads up that you might have been coming. So it takes a lot of flexibility, I think, on everyone's part to make it a good experience. I chose emergency medicine because as somebody with a military background, I really appreciated the role that teamwork played. And to me, emergency medicine is the ultimate expression of teamwork in the hospital leading to great patient care. I absolutely see a lack of primary care as a reason people show up to the emergency department. Oftentimes, people with chronic conditions who haven't been able to access care might not be on medications that can prevent big consequences. So we'll see people with untreated blood pressure issues come in with a major stroke, for example. People with uncontrolled diabetes come in some sort of a diabetic crisis, for example. All of those things probably could have been addressed earlier on with preventative medications and counseling and just having a patient form a good relationship in the outpatient setting with a primary physician. But when it comes to a head, the ER is often where they end up. And sometimes, we end up managing chronic conditions in the ER and doing a lot of primary care work just because that's the work that's needed. Some of the gaps in our current healthcare system manifest in ways that can be really problematic, especially for older adults. One of the most common presentations we'll see in the emergency department is, for example, somebody who fell or is getting progressively weaker. They don't really have a serious medical condition that needs hospitalization, but they're not really able to live safely in their home anymore. As a country, we don't really have a system that effectively takes care of those patients. We have insurance systems and reimbursement systems in place that necessitate or require payments for inpatient levels of care, but if a patient doesn't meet that and they're stranded in the emergency department, it can be tough to figure out a plan that doesn't leave the patient or their family saddled with a big bill. And those are really tough conversations to have when somebody is kind of at a crisis moment in their life. If I were speaking to a room full of congressmen, I'd say, think about somebody in your life that's getting older, and maybe the last time they had to go to the hospital or they needed medical care. A lot of the things that come with getting older are really difficult, and there's a lot of care involved closer to the end of someone's life. And we spend a tremendous amount of money and resources on providing that care, and a frankly unsustainable amount of resources. And I think it's important that if you think about somebody in your life you love and what aging might look like for them, we need to find ways to design our care that doesn't bankrupt us as a country, and also make sure we honor their dignity and their aging in a very thoughtful and respectful way. The only other thing I would want you to know is that I think everyone in healthcare is trying their hardest. This has been an exceptionally challenging time for all of us as a country since the pandemic, and it's really upended and reshaped healthcare. But at the end of the day, especially in the emergency department, we're excited to take care of you. We're doing the very best we can, and we look forward to the opportunity to serve you.